All right. Well, welcome back. I have the pleasure of sitting down with Heather Gleason, Chief Information Officer of Northern Arizona Healthcare. Heather, thank you so much for joining us.
Thank you for having me.
I can't wait to talk to you a little bit about AI in action. You feel the energy in the summit.
Absolutely. It's been amazing so far.
It has been amazing. And I feel like even the tone has shifted a bit and everyone can feel it.
Yeah. From last year to this year, it's huge difference. Just in the excitement in the air and seeing stuff really come to fruition has been amazing.
That's incredible. It's like it's happening now. We're not just talking about it.
We've been waiting for a while.
Right. And we're doing it, which is exciting. Well, talk to me a little bit about Northern Arizona Healthcare and the work you're leading, your mission.
Yeah, our mission is really around rural health. We're the only healthcare provider in Northern Arizona, anything north of Phoenix, and really taking care of an indigent population of people. We have the Native American, two of the biggest tribes in Arizona are located right close to us. And so really working to take care of them better and get them the health services that they need has been a big priority for us for the last year that I've been here.
Well, thank you for leading that important work. So you are unique because you are the largest healthcare organization in a region that spans more than 50,000 square miles. So
Crazy.
What does a scale like that mean in the way that you deliver care?
It's much different. We were talking about this earlier today with some clients, but in Northern Arizona, a lot of the times we get the sickest of the sickest. And we have 12 helicopters and a fixed wing, and we also have the ambulance service. And so we're bringing people in when they're on their deathbed sometimes, unfortunately, because they can't get the care they need in the region. We also get tons of tourists from all over the world, honestly, that injure themselves thinking that they can hike the Grand Canyon.
I will not ever be one of those.
Yes,
okay?
thank you. Please don't.
Good.
Please don't. We also have Snowbowl, which is the only Arizona ski resort. And they make tons of snow, even though we get a ton of snow in Flagstaff. But everybody says, Arizona gets snow? And lots of injuries that come off of that mountain because we're so close to Mexico. And just people come that don't understand how hard it is. And so our EDs are always very busy.
Wow. Well, and so along the way, what have you faced fulfilling that mission that has been challenging? What challenges are emerging today that you see that are new?
The biggest one is interoperability. We have a lot of small hospitals in the community, rural hospitals that we can't get their data. And it's the number one thing the doctors have asked me for since I've been there.
The data.
Is the data. We need to see what's happening in all venues of care, not just when they get to us, because other people are trying to take care of them. And so figuring out how we're going to really make that work for us is really important for our physicians and nurses in particular. I think the other big barrier that we're seeing is we don't have a lot of adoption of technology because they don't have cell towers on the reservation. And Arizona doesn't have a lot of fiber, actually. And in Flagstaff, we're on a mountain of lava.
How?
And so getting fiber in the ground is really difficult, too. So it's really the interconnectedness that are challenges for us today. And making sure that information gets shared across all the networks has been a troublesome point for us.
So then how is Oracle helping you address those?
So several ways. Doing seamless exchange. We're doing lots of different projects with Oracle right now to make sure that we can communicate with some of these rural hospitals that we historically have faxed. I heard this morning 15 million faxes a month or something. I was like, oh, I believe it. We probably do 10,000 a day, and so really trying to remove some of those paper barriers and start to integrate the records and have them face up is going to be super important for our clinicians.
Absolutely. Well, you were an early adopter, I should say, of the EHR. By the way, thank you for that. and now you've taken on the next step by integrating Oracle Health with Oracle Fusion Cloud applications, and you're taking it forward. So can you share with me, what that integration has meant?
So I'm a long-term Cerner partner. I worked at Cerner for a lot of years, and this is the first time that I am jazzed. Honestly, like the amount of data that's going to cross the continuum and let my providers take care of their patients, but let my operations people actually focus on the right metrics instead of whatever random metrics I can pull up for them on an Excel spreadsheet or a stagnant dashboard. What I'm seeing from the Fusion, FDI, and HDI integrations, I can't wait. We go live in April, and just from our last round of integration testing, it's a game changer. And we never really did reporting that well when at Cerner. And so to be able to pull it all together and provide that data real time is super exciting.
That's incredibly exciting. And I love that you use the word jazzed. If you want to pop out a jazz hand, we can do that as well. But this is an integration that you're now, putting into action. Is that helping to solve those problems that you talked about earlier?
It is. I think we were a little bit behind the times as far as technology. And we had about 55 different applications that just to get employed, you had to go through 10 of them to apply, recruiting, all of that stuff, and to be able to use the Fusion applications to seamlessly change that. We also have a really big problem with recruiting because it's Flagstaff and it's 70,000 people, and its cost of living is intense, and so it's really opening up our world to how we can engage with others as well and bring in from other communities. So it's holistically, it's like I said, I'm jazzed. It's really exciting.
And are you seeing this impact on the clinicians at a broader level on the healthcare ecosystem?
100%. We did CAA just recently, and I have 71 doctors that love me right now. And that doesn't happen very often when you're a CIO. Not a lot of people can say that. And I know I heard all the good things about it, but it's just really exciting to see how it's all come to fruition.
That makes me happy. And for the patients too, you're seeing that as well.
Yeah. It's funny. We were just talking at lunch about the portal, and we finally are upgrading our portal to the old portals.
Wow.
Yeah. So we're just a little bit behind in the technology, but then
you're getting there.
My team asked me today, they're like, well, why are we working on this? Why don't we just wait? And I think that having a nice clean cut from a consumer engagement perspective to say, hey, look at this new stuff we're going to do together.
Yeah.
I think is going to be really exciting because consumer is the other thing that's really driving a lot of our business right now, is trying to get everyone engaged in their health, honestly. And we haven't been big users of the portal to date. And so we're hoping to change that as well. I'm really excited about it.
I'm excited too. And we are both jazzed. So thank you so much, Heather, for joining us.
Yeah,
and we are going to take a quick break and then be back here with more conversation on AI in action.